Good afternoon. I'm Dr. PIYUSH, and today I'll be taking the topic Oral Hygiene Index. It's given by the John C. Greene and Jack R. Vermeulen, given in the year 1960. Debris Index plus Calculus Index is equal to Oral Hygiene Index. Scoring is done for the debris and the calculus on all the teeth. Exclusion, third molars, incomplete erupted teeth. The procedure: buccal and the lingual surface of the teeth in the right posterior region, beginning from the second molars, are inspected and scored. Then the labial and lingual surface of the upper anterior teeth are examined. Finally, the buccal and the lingual surface of the teeth in the upper left posterior region are examined and scored. The lower arch inspection proceeds in the same manner, but from the left to right. Method of scoring for the debris: the surface area covered by the debris is estimated by running the side of a number of explorer Schaefer's hook along the buccal, labial, and the lingual surface, and noting the occlusal or the incisal extent of the debris as it is removed from the tooth surface. Now, the criteria for the classifying oral debris. Oral debris is defined as the soft foreign matters on the surface of the teeth, consisting of the mucin, bacteria, and the food, and the varying in the color from the grayish white to green or orange. Now, the debris index, the score and the criteria. The score 0, no debris or the stain present. Score 1, soft debris covering not more than 1/3 of the tooth surface or presence of extrinsic stains without the other debris regardless of the surface area covered. The score 2, soft debris covering more than 1/3 but not more than 2/3 of the exposed tooth surface. Now the score 3, soft debris covering more than 2/3 of the exposed tooth surface. Now the criteria for the classification of calculus. Dental calculus is defined as a deposit of inorganic salts composed primarily of the calcium carbonate and the calcium phosphate, mixed with the food debris, bacteria, and desquamated epithelial cells. Now, the supragingival calculus denotes deposits located occlusal to the free gingival margin and is usually white to yellowish brown in color. Now, the subgingival calculus denotes deposits located apically to the free gingival margin, which are usually light brown to black in color because of the inclusion of the blood pigments. Now, the calculus index, the score criteria: 0, no calculus present. Score 1, supragingival calculus covering not more than 1/3 of the exposed tooth surface. Score 2, supragingival calculus covering more than 1/3 but not more than 2/3 of the exposed tooth surface, or the presence of the individual fletch of the subgingival calculus around the cervical portion of the tooth or both. Now the score 3, supragingival calculus covering more than 2/3 of the exposed tooth surface or a continuous heavy band of subgingival calculus around the cervical portion of the tooth or both. This is the diagram. You can see that the plaque in the score 0 1 covering the 1/3, in the 2 1/3 but not the covering the 2/3, and it's in the 3 it's covering more than 2/3. The segments, different segments, segment 1, 2, 3, 4, 5, and 6. Now the calculation of the index. The debris index for an individual is determined by totaling the debris scored, recorded, and then dividing by the number of the teeth scored. An identical procedure is used for the determining the calculus index. The two of them are then combined and expressed as the oral hygiene index. This is the representation of the chart and the calculation. The debris index is equal to total debris scored, recorded, upon number of segment recorded. And the calculus index, excuse me, total calculus scored, recorded, upon number of segments recorded. Now the oral hygiene index simplified. It's given by the Jack R. Verwillian and John C. Greene. It's given in 1964. The simplified oral hygiene index, or OHIS, differs from the OHI, the oral hygiene index, in the number of the tooth surface scored, 6 rather than 12. The criteria used for the assessing the scores to the tooth surface are the same as those used for the OHI, oral hygiene index. So the oral hygiene index is equal to debris index simplified plus the calculus index simplified. Now the selection of the tooth surface. In the posterior portion of the dentition, usually the first molar 1/6, but sometimes the second 1/7 or third molar 1/8 is examined. The buccal surface of the selected upper molars and the lingual surface of the selected lower molars are inspected. In the anterior portion of the mouth, the labial surface of the upper right 1/1 and the lower left central incisor 1/3 are scored. In the absence of either of this anterior teeth, the central incisor 2/1 or the 4/1 respectively. On the opposite side of the midline is substituted. It's the diagram representing the same. Now we come to calculation. The calculation debris index simplified is equal to total the debris score upon the number of the surfaces examined. The calculus index simplified is equal to total the calculus score upon number of the surface examined. Now the interpretation. DI scores